just going to give people another minute or so to get logged on. We're going to be talking today about hormones and specifically about menopause and andropause and some of the shifts that happen within that time frame. So we're going to go ahead and get started here. We've put out a little poll just for people to fill out if you want to, asking you guys if you know what the average age of menopause is for women in the US. So go ahead and enter it into the chat if you want to, and we'll be addressing that in just a second. And also, we just want to invite you guys to write questions in the chat that we can address at the very end. We really love sharing this information and really want to make this valuable for you all. So please go ahead and write any questions that come up as we move through the slides. We're not going to be pausing and taking questions while we're going over the slides themselves, just because we want to make sure we get through all the information, all the core information. But once again, we really want you guys to get a lot out of this today. So if questions come up, don't hesitate to write them down, and we will make sure to address them. So I want to introduce our panel here of docs. I'm Dr. Molly Force. I'm the clinical director at Prosper Natural Health, and we have a naturopathic care team here in Port Townsend that I think is pretty phenomenal. We've got Dr. Rosalie and Dr. Mary, as well as myself, and we're all naturopathic physicians, which means that we all do primary care medicine, but really specialize in treating people naturally, first and foremost. And Dr. Rosalie also comes with some specialized training in Ayurvedic medicine, and Dr. Mary has an acupuncture degree as well and specializes in traditional Chinese medicine as well. So as we go through our slides, we're going to be talking about some naturopathic approaches, but also some other approaches that are natural medicine, not essentially based here in the US, but that have a lot of wisdom to them as well. So we love this very holistic approach and the team care that we can offer. So for those of you who took a moment and entered into the poll, we can see here that our average age of menopause is actually 51 years old. And this happens for some women much earlier, even in their early 40s. And a lot of times you can talk to women about what the experience of their mothers or grandmothers were, and then also what their aunts and sisters experienced as far as their hormonal changes. So we see a lot of these things kind of follow within the family. And for some women, they go much later. You know, they can be having their periods into their 60s. So it's a really broad spread of when it happens for different women, but the average age is those early 50s. So today we wanted to make sure you guys understand the physiology behind hormonal transitions, and then talk to you guys about ways to really support the body so that as we're going through any of these transitions, we really are as healthy and as balanced as possible. So when we see transitions of hormones, some of the symptoms that our body provides to really get our attention are things like hot flashes. We hear about that a lot, and many of you have probably experienced them. I certainly did when I had my kiddos in the postpartum period of time after having babies. It's amazing how these hormones surge, and as the hormones are leaving the body, we can get these hot flashes that happen. We also can experience weight gain, whether no matter what our gender here is. Weight gain is a big piece that is a sign a lot of times that the body is letting us know that there is an imbalance going on for our hormonal system. We also see low energy for some people as our hormones start to become tipped, and low libido, sorry for the typo there. Low libido is another one. And that makes sense as we start to see certain hormones decrease, specifically like testosterone. We can see that our sexual prowess decreases. As far as muscle and tendon pain, that's not something that everybody might associate right off the bat, but it's a huge one. When I'm talking to people who are going through these hormonal transitions, a lot of times they'll tell me, yeah, I'm more tender, or my muscle rebound is not what it used to be, or I tend to have more tendon pain or muscle pain after I work out or am active. So these are really important signs that our body is often trying to send to us. Bone loss is another big one that sometimes we overlook, but we know that these hormones send very direct signals to the tissues that are on the bone, and we're going to talk about the cellular interaction there today. And we want to keep that in mind, because when we're thinking about preventative medicine and aging gracefully, we really want to make sure that our bones are as strong as possible. Brain fog is a big one. Whenever we have these hormonal shifts, our brain and our ability to function and cognitively really pull details can be very much affected. Headaches are another big sign that there can be a hormonal imbalance. And especially when we're thinking about migraines, that's a big red flag in our practice about hormonal triggers. We also see potentially mood changes, different mood shifts that can happen for some people. And then things like autoimmunity and different immune triggers that can be really stimulated by hormonal shifts. And we'll talk about that as well. And then we see hair and skin changes too. And once again, that has to do with these cellular receptors and how they're receiving this information from the hormones. So just to give you guys a broad picture, when we're dealing with somebody coming in with hormonal shifts that they might not even be linking with hormonal shifts, oftentimes we're hearing things like, oh, my skin, my hair, my nails are changing. I'm having, difficulty thinking. I don't have as much of a sex drive as I used to, and I'm having these headaches, and I'm not really feeling all that good physically. I'm having lower energy. So these are kind of the flags that we're looking for as physicians. Now, our goals with these patients are really trying to find that physiologic balance. We don't want to override the hormonal system. We really, as natural practitioners, want to be helping the body find balance, finding that homeostasis. So we really want to be focusing on the protective benefits that a balanced hormonal system provides. And we want to be making sure we're not giving too much to one or a few sets of these hormones. And so the things that we want to really be protecting with that hormonal balance are our cardiovascular health. Many of you have probably heard how important hormones can be in regards to cardiovascular health. We know that neurologically, with reducing things like dementia and having a properly functioning central nervous system and brain, these are very dependent on proper hormone balance. Bone, as we spoke about earlier, is just so tied in. That bone health is just so tied in with our hormonal balance. And that plays out in the musculoskeletal realm in regards to tendons as well, and muscle rebound. And then the immune response too. So we really want to make sure that we're helping people to find balance for their hormonal system, for what's appropriate for their age demographic, and what they also are wanting to really do in regards to what they have goal-wise to accomplish with their bodies and what they consider to be critical for their quality of life. We certainly don't want people to have major hot flashes and things like that that are going to be disrupting their sleep ultimately, and therefore play out with lower energy and difficulty with concentration, for example. So I'm going to let Dr. Mary take this next slide on evaluating hormones.
Okay, so there are a number of ways we can evaluate hormones. And one of the first things we think about is symptoms. So for instance, if someone's having really significant insomnia in their menopausal years, we often think about low progesterone being involved, versus if someone's in their perimenopausal, going into the menopause transition phase, and they're having really heavy bleeding with irregular periods, that's signifying that there's estrogen fluctuating, getting really high and really low. So we also really love to look at numbers and see what is happening in the bloodstream and in the tissues in an in-depth way. And so there's a number of different testing strategies that we can use. One is looking at just a regular old blood test. Another is a salivary testing. And then there's the finger prick. Next slide, please. Thank you. So this is just a layout of what you can see with these different types of testing. And it's really fascinating because each test gives you a snapshot of what's happening in different parts of the body and different tissues. And we really like to use salivary testing in our practice, largely because it's easy to collect, no blood involved, and it has a more accurate depiction of what's in the tissues. And that gives us a sense of how these hormones are really affecting your physiology. We also, oh, perfect, thank you. Yeah, you can go on to the next one. So what are we testing here? So when it comes to the estrogens, we're looking at E1, which is estrone, and that is the one that's most prominent after menopause. We also look at estradiol, which is the most prominent estrogen during our reproductive years. And then estriol is it's the dominant hormone during pregnancy. We also look at progesterone, testosterone, and then DHEAS is a precursor to all of these hormones. So that gives us a really in-depth look at what's happening on the pituitary level. And then we like to look at cortisol because cortisol shares precursors to these sex steroid hormones, and it's known as the stress hormone. And so when we're under a lot of stress, sometimes our precursors can actually get shunted into the stress pathway. And so that can give us a signal of how stress can be impacting our hormone levels on that level. Next slide, please. All right. Send this off to Rosalie.
Thank you, Mary. So this is one of my favorite slides, actually, because it just shows you the biochemistry right there. It kind of clarifies what Dr. Mary was saying, in that all of these hormones are interrelated. And you can see at the top left there, cholesterol is the backbone. Okay, so cholesterol actually makes these hormones, and sort of downstream via all sorts of enzymatic activity, we get to progesterone, we get to DHEA, we get to the bottom there, testosterone, and to the bottom right, we see our estrone or estriol or estradiol. All of these are interrelated. And what we do in naturopathic medicine is we try to figure out where, with the testing, where is there an increase, where is there a decrease, and how we can sort of support the optimal hormone balance, essentially. And so cholesterol, surprisingly enough, is quite important in terms of making hormones. When we go through menopause, that cholesterol backbone is no longer making the robust amount of hormones that we are used to making. So that's why typically we see higher cholesterol in our menopausal and andropausal people, because it's not shunting downstream to all of the hormones. So it's nonetheless important to sort of support that backbone. It is very useful in making the cell membranes of all of our animal vertebrate cells. Okay, not just us, but also all sorts of other animals. Plants don't have cholesterol. They've got a similar molecule, but it's not the same. It gives our membranes stability, but it can also give them stiffness if it is in excess. Cholesterol also has several functions. Like I said, it's the building block for hormones. It builds testosterone, estrogens, progesterones, and curiously enough, one of our fat-soluble vitamins, which is vitamin D. So often when I'm testing hormones, I also like to see what the vitamin D status is. It's hard to make good, healthy hormones when you've got low vitamin D as well. The cholesterol molecule is also very important in transmitting nerve impulses, right? Our brain matter is mostly fat, and that includes cholesterol cells, okay? It helps as well in the bile, which is made by the liver and stored in the gallbladder, to emulsify dietary fats, which just means it helps to digest them, okay? Cholesterol also, when it's not oxidized, is an antioxidant, okay? And it also helps with building our neurotransmitter, which is known as serotonin. All right, there's been studies that show that folks with low cholesterol can also tend to have symptoms like anxiety and depression, which are related to that serotonin change. And lastly, cholesterol is quite important in intestinal wall health. And that mostly has to do actually with the microbiome on the inside, the microflora inside our gut. So we're probably familiar with these cholesterol-rich foods. Since they're only found in the cell membranes of animals, they're only in animal products. Mother's milk is nice and high in it. That's because baby has to grow very robustly in those first few months to ensure survival. And they're building their brain, right? It's going directly into the spots that need it. Eggs, dairy, meat, poultry, fish, shellfish, all of our animal products sort of contain in various amounts, different amounts of cholesterol.
So when we're thinking about these hormones, we see that cholesterol is the highest upstream. And like Dr. Risley was mentioning, we think about this as being important, especially from more of a functional medicine perspective, because when we're looking at people's lipid panels, it's really important for us to think about what's going on with their hormonal system. You know, are they already going through a menopausal change, or have they been postmenopausal, or are they in andropause, more of the male equivalent? And are we wanting to look at the exact same numbers as being our goal for each of these different systems? And I would, as a physician, argue no, and that we have to take in that information about where they are in their hormonal curve. So as far as pregnenolone goes, that's another upstream hormone. It's something that we consider to be this building block that a lot of these other hormones are coming from, they're cascading down from. This is something that's typically produced by our adrenal gland and is directly converted from cholesterol. So if we don't have enough cholesterol, if we're in a starvation state, or we're not getting enough cholesterol for whatever reason, or we're on a suppressive drug that's keeping it very low, then it can cause problems with our production of the pregnenolone. And then downstream, we see problems with the production of our estrogens and our progesterones and our testosterones. So we do want that conversion to happen. And on the labs, what we see is we're not usually testing pregnenolone directly, but we'll see low levels for the estrogens, the progesterones, testosterone. They'll all be low. The DHA, all of it will be low when a person is struggling to produce that pregnenolone. And we can give pregnenolone directly to these people if we feel like it's appropriate. So I always like to go over this concept with my patients who are undergoing hormonal shifts. It's important to remember that these hormones are not existing in a vacuum in the body. They're affecting very much our different tissues and our different organs. And what we see is that when there's an effect, especially when we think about like the ovaries or the testes, when there's a change that happens in that arena, we can almost always predictably, there we go, as physicians, look at two other organ systems to see if they're going to be affected too, the adrenal glands and the thyroid. So it's really important for us to say, oh, okay, if you're going through a hormonal shift that may be age appropriate, may be normal, we need to say what's going on with your adrenal glands and what's going on with your thyroid, because these are different tissues that are very influenced by the ovaries and the testes functions. So one of the pieces that really helps pull us through when we're going through these hormonal shifts are the adrenal glands, because they affect the production of so many of these other hormone systems. The thyroid, we often will see hypothyroidism start for people during times of major hormonal shifts. So that's something that we always just like to keep in the back of our head. So if you are somebody who's dealing with hormonal shifts, take a moment and really consider, is your thyroid functioning the way you want it to be? And same thing with your adrenals. Are they doing the job that they're supposed to be? So let's talk about the adrenal glands, because they come up so much. And once again, when our testes and our ovaries are decreasing their hormonal production, it's really up to our adrenal glands to rev the system to produce the hormones that we need to still function and still be feeling good, post-menopausally, for example. So when we think about the adrenal glands, it's responsible for creating several different types of hormones. One of these types is what we talked about earlier with cortisol, and that's considered a glucocorticoid. It's very much tied into our hormonal system that regulates our blood sugar control. So that's why it's called gluco, like sugar, glucocorticoid. And then we have our mineral corticoids, and that's something like aldosterone, which affects our mineral regulation in the body and whether or not the kidneys keep or release minerals in our body. And that helps affect our blood pressure. So when we're thinking about blood pressure changes and hormonal changes at the same time, we can see that the adrenal glands may be implicated here, may be part of that effect for people. Androgen hormones are also created by the adrenals. That's our testosterone and our DHEA, sorry. And so those are, hormones, once again, that we can directly check, but we know that as we go through these changes with once again, our testes and our ovaries, then we start to have our adrenals, who are really responsible for increasing that DHEA and the testosterone to help us still feel good and still meet our hormonal requirements as humans. We also have these catecholamines that are produced, and those are kind of more like the fight or flight hormones. So we think about them as epinephrine, norepinephrine, which you guys have probably heard about. And these are really important for us for survival reasons. And they're also considered stress induced reactions for the body. So we have, these adrenal glands, of course, they're sitting on the top of the poles of our kidneys, and they are just pumping out these hormones, and they're responsible for quite a bit. We talk about this dysregulation that can happen in adrenal glands when we undergo severe stress for a long period of time. So you can see in the green phase, this is a chart just to kind of show these different stages that can happen. This is the adaptation phase. It's considered when we're in homeostasis, we're not incredibly stressed. But then when we have this stress, this acute or immediate stress that happens, we get a pumping out of these catecholamines, especially from the adrenal glands. And if this continues to happen, for example, in our society where we have chronic stress continuously, or maybe, for example, we've just all gone and are going through this current pandemic, and there's a lot of adaptations that need to be made in regards to that. We have increased catecholamine production because of that. That can eventually cause an imbalance, and that our adrenal glands may not be able to keep up with the production required. And we start to get into this more collapsed or exhausted state. And this is a really important, because if we're going into hormonal transitions that are dealing with estrogens, progesterones, and testosterone, and those ratios, and we're already going into those in a collapsed state because we've been under severe or chronic stress for years and years, or we haven't been eating and routined with our sleep, and our adrenals are stressed from that, it makes those hormonal transitions much more challenging. So we see this both for kids who've been under severe stress when they go through puberty, and we definitely see it for older adults who are starting to transition or going through the transition of menopause or andropause. So those adrenal glands are just so critical for our ability to deal with our alarm stage, our intensity reactions. And we see initially that we have this slump that can happen with our immune system when we have this high epinephrine state. We may even drop weight initially from that, but when we get into the resistance stage, that's where we see people gaining weight, having more resistance to those their blood sugar, having issues with that, and we see that immune state typically continue to stay depressed. And when we get into that exhaustion state, we really can't produce that epinephrine that we need. We can't produce that get up and go to react to stress. And we start to see pretty significant premature aging because of the challenges that the adrenal glands are having for picking up their responsible load for the other hormonal systems. So in regards to our testing, we are often wanting to do these salivary tests, because once we are implementing changes for our hormonal system and potentially even giving bioidentical hormones, which we're going to touch quite a bit here today, we often want to see what's going on with the saliva, because it really helps us know what the tissues are doing with those hormones. So there's different things that we often are requiring of our patients. We really like to see people in person. It makes a big difference for us to be able to do some of the exams needed, screen their adrenal glands. There are ways that we can do that in office, as well as their thyroid glands, and just get an idea of how they're doing in regards to their tissues and their skin health, their hair health, their nail health. Salivary testing is just so very helpful. It's a kit that we send home for people. And then sometimes we'll do blood testing too. And that's really important for us to be able to look at our adrenals. We can catch some pretty quick imbalances that are happening just simply with an annual blood work panel. So make sure you're getting those annual blood work panels. They really help us pick up on slight changes and imbalances early on, and it can make a huge difference for people. So the last piece I want to share here with you guys about testing and thinking about our adrenals specifically is that adrenal stress index test. And that is when we're looking at cortisol, a salivary, so a spit test here, once again, look at what's going on with your cortisol 4 times throughout the day. And this is considered gold standard. So much in my scientific world has been this conversation with myself about like, oh, wouldn't blood be so much more accurate? But for this, we're actually wanting to see cortisol. And because we want it 4 times throughout the day, it's so much easier than having somebody going into a phlebotomist for 4 times throughout a day. And what we see is our cortisol increases to help wake us up. That depresses our melatonin. It gets us going for the day. And then throughout the day, we should have a nice steady decline that kind of ramps into our evening so that we can get a nice sleep. So we want to be thinking about not just cortisol in an instant to see how the adrenals are being affected. We want to think about how it's reacting throughout the day and how it's also reacting in regards to its ability to manage stress.
All right. So as you can imagine, cortisol is necessary for us to function throughout the day, to feel alive in the morning, to perform. But when it's too high, it can become problematic. It is involved in the anti-inflammatory response, so it reduces inflammation, which over time can predispose us to immune dysregulation. It can increase blood sugar, which can predispose us to metabolic syndrome. And then it can increase sodium, the sodium to potassium ratio in our bloodstream. So causes us to absorb more in our kidneys. And this can lead to increased blood pressure. So again, while we want all of those things in moderate amounts, we don't want it in excess. Next slide. All right. So some of the ways that we like to support our adrenals include adaptogens. This is one of my favorite herbal categories, and it's a type of herb that helps to dampen the cortisol response to allow us to have a more controlled release of cortisol throughout the day. So this can be really helpful for that sort of wired and tired person that's tired all day and awake at night. This is really great for rebalancing that cortisol diurnal rhythm. Yeah, we can move on. Okay. Yeah. So exercise is another really important one, particularly morning exercise, getting that cortisol going first thing in the morning. And meditation is another way to calm the nervous system and help control that release of all of those stress hormones that Dr. Molly was talking about, including cortisol and epinephrine. Next slide, please. So in terms of the adaptogenic herbs that we like to use, they all work in a similar mechanism, but each have a different flavor. So Panax ginseng is one of the more popular ones, and it is rooted in traditional Chinese medicine, and it's one of our really stimulating adaptogenic herbs. Other ones that are more, that actually stimulate, they're stimulating to the body, but calming to the mind, are Siberian ginseng or eleuthero and ashwagandha. Rhodiola is one that we really like to use to improve mental clarity. And then glycyrrhiza or licorice is one that actually has a compound in it that mimics cortisol. So it's really great as a stimulating adaptogen, and it can also increase blood pressure. So it's good to look out for in those formulas and make sure you're not getting too much of it. All right.
So if you think back to our slide a couple slides ago with that big triangle where we looked at thyroid, adrenals, and hormones, that's kind of the big picture to think about here. And we spent a couple of slides talking about how to support those adrenals, because without the adrenals on board, it's really hard to manage the hormones. So in terms of specific hormonal hacks that we can do from a naturopathic perspective, there's a lot. And we sort of start with low intervention stuff and lead to more higher intervention sort of pharmaceuticals. So a lot we can do with diet and lifestyle, including increasing fiber or doing seed cycling, things like that. Next step up, if we need more support, are herbs, which there's several herbs in the Materia Medica that are phytoprogesterone or phytoestrogen or phytotestosterone, which just that word phyto means plant-based. So it mimics our human hormones and sort of stimulates or modulates the receptors in our bodies, the hormone receptors in our human bodies. Next step up, if we need even more support, is prescribing perhaps a compounded cream, which contains bioidentical hormones, which Dr. Molly will talk in depth later about. And then, you know, the future plan would be things like conventional hormones. If you truly need the sort of synthetic help, like the estrogen patch, things like that, that's kind of what we end up doing in the naturopathic world. So hormone hack number one is movement. And this is, you know, a baseline requirement for a healthy life, but it also helps so much with the hormones. And it really depends on your abilities, your personal goals, because we also don't want to do excess exercise where we're sort of taxing the body, increasing the cortisol too much, taxing the adrenals, right? So it definitely has to be in a moderate amount, but definitely not stagnant and immobile, right? The other piece here is when we move our bodies, we move our muscles, and that moves our lymph. And a lymph and helping encourage the lymph is actually helping the detoxification system. So remember how the hormones were created by cholesterol, and then sort of different tiers of hormones are made from that cholesterol backbone. Because it's a fat soluble, because hormones are fat soluble, we need to sort of encourage them to be released from the body. It's not like they come out in the urine very easily, okay? So movement, exercise, lymph movement, encouraging the bowels and the detoxification system also helps with with making sure those hormones are cycling through the body and not recycling the bad forms of the hormones, which are the 16 hydroxyestrogen forms. So to move lymph, like I said, we also have to do some therapeutic sweating. And this is something I do recommend to my patients. Make sure that they are sweating every day because our skin is our biggest organ. It's the one that helps us the most with detoxification. Like it says here, it engages the body's natural elimination route. Heating the skin will also increase the speed of normal metabolic breakdown of fat tissue. So remember, these hormones are fat-based, they're lipophilic, and they're not water-based. So they're not getting excreted easily in the urine. So we've got to find other ways to sort of move them through the body.
So our next hack has to do with eating these healthy fats. And we've kind of gone over now this idea of cholesterol actually being really helpful for building hormones. And of course, everything is needing to be within moderation. But when we think about these healthy fats, they really are helping us with the building blocks, not just the fats that are animal-based that have the cholesterol component, but also our healthy fats that are going to be plant-based. They are also going to be helpful for our body to produce these hormones. So one of the biggest, healthy fats that I'm often thinking of are the marine lipids, or the fish oils, or the algae-based or krill-based lipids. And these are just so important for our brain function, but also for these building blocks that we need for our hormonal systems. We also have the ability to, utilize things like good quality butter, good clean pressed olive oil, flaxseed. We know that we're going to talk about flax being a phytoestrogen, our coconut oil being another really good one for cooking. I often am thinking about more of the fruit oils like the olive oil, the coconut oil, and avocado oil when I'm thinking about cooking, and healthy options for that. And then things like including our egg yolks, because those are going to be so cholesterol rich as well, if we tolerate eggs. And then our nuts and seeds being really helpful. So in regards to seeds, there's actually a really fairly powerful thing that can be done with seeds and seed cycling. And this is something that I utilize with a lot of my patients who are maybe wanting to continue with their cycling for fertility reasons or things like that, but they're starting maybe to have some irregularity there, or maybe they're postmenopausal and they're wanting to, in a very natural, naturopathic way, provide balance without taking hormones or without giving their body any pharmaceuticals to reestablish that balance. So a very simple categories of seeds that have phytoestrogens and phytoprogesterones can be used. They can be used in combination, or they can be used in the cyclic way. And if we're using it in the cyclic way, it can really encourage the menses cycle. For men, oftentimes are looking at their labs and saying, okay, we want more progesterone, for example. So let's make sure that we have more of these phytoprogesterones. So some of the ones I'm most often using in my practice and we're using at Prosper as a care team are things like pumpkin seeds, because they're so easy to snack on. Now we want to have these raw. We never want these seeds to be toasted because that makes our oils rancid and it denatures what we're going for here in regards to the phytoestrogens and the phytoprogesterones. It really affects them. Same thing with the flax seeds. So if we're using flax seeds, we're asking people to buy them raw and then fresh grind them. They can put them in the freezer after they've ground them if they want to make a batch and just scoop from that. And then Same thing with our phytoprogesterones. We're usually using typically things like the sunflower seed and sesame seed, or supplementing with evening primrose oil, which has that GLA in it, which is a nice strong phytoprogesterone. So these are just great to incorporate. They're easy to sprinkle on salads. They're easy to take and make a blend of and grind up, and just take a spoonful when you're ready right out of the fridge.
Okay, so hack number 4. This is my second favorite category of herbal medicine, and this is the phytoestrogens. So what's so cool to me about the phytoestrogens is that they're binding to our estrogen receptors, but they're not binding as strongly as the estrogens that we produce in our body. So that can help give us a modulating effect for our estrogen receptors, whereby if your estrogen's way too high, it's gonna bump it down a little bit. And if it's way too low, it's gonna bump it up a little bit. So the main phytoestrogens that we find are called lignans and isoflavonoids. Genistein is one of the main ones that is extracted and used in formulated products, and that's found in soy. We know that from epidemiologic studies that soy is in the diet is really great for easing the menopause transition. So one really fascinating aspect of this, of the metabolism of these hormones, is that they're converted by intestinal flora to the estrogenic compounds. So their effect can actually be quite variable depending on the health of your gastrointestinal flora at any given time. So the main things that we use them for are to modulate hot flashes, increase the maturation of, so they have been shown to increase the maturation of vaginal cells. So we can use them systemically and topically for a small estrogenic effect in the vagina for vaginal atrophy. And they've also been shown to mildly inhibit osteoporosis. So again, long-term consumption of these compounds in food and through herbal formulations can help us build bone over time. So our main phytoestrogen sources are going to be soy, flax, fennel, sesame, alfalfa, red clover. These can all be incorporated into the diet. And then there's some major ones within the herbal medicine realm, including white peony and romania, and licorice even has some phytoestrogens in it. So our major player, it's sort of the big guns when it comes to phytoestrogens, is an extract of maca, and it's the product we like the most is called Feminescence. I really appreciate the way that this company identifies specific strains of maca, and they've found slightly different estrogenic effects with each strain. And so they can offer really targeted estrogenic support for women in different and men in different phases of their life. So it's been shown to support libido, support sexual hormone balance and adrenal balance. So we really like to use this one a lot. All right, and so specifically for breast cancer risk reduction, flaxseed is one that we really like to incorporate into the diet. One of the things it's going to do is increasing the fiber to bind up any excess estrogen that's secreted into the GI tract and prevent it from recirculating. It also, again, provides that really low level of estrogen, so low level of estrogen binding at the receptor, so it can kick off the more potent estrogens that we create in our bodies. All right.
So this next hack has to do with our brassicas, which are our cabbage and broccoli and kale family. And this is not just specific to menopausal states, but also andropausal states. So this Brassica family, it has a very, it's known for its anti-cancer effect, and specifically in terms of preventing the bad estrogens from re-recycling in the body and causing inflammation. Okay. And so the strongest antioxidant in these sulfurous veggies, in these brassicas, is a sulforoglucosinolate, SGS, okay, which is just a type of molecule that is sulfur containing antioxidant. And it's apoptotic, which means it causes cell death to our cells, the cancer cells more specifically, or the ones that are full of inflammation, okay? So other constituents in this Brassica family include indoles and diindole methane, DIM. The indoles that are sort of extracted from the cabbage help with, again, pushing the bad estrogens out through the GI tract. The diindole methane, it helps in terms of preventing the estrone, the inflammatory estrogen, E1, from being created and keeping it as an E2, estradiol, which is the sort of protective estrogen, essentially. And again, just that anti-cancer piece, it helps with chemotherapy. It also helps with, in terms of the genetics, the HER2 new mutation. Calcium D-glucarate is our next constituent that's extracted from this wonderful food. And there's studies that show that having more calcium D-glucarate in the diet or supplementing it actually decreases cancer risk from these hormone-specific types of cancers, which affect both men and women, especially in that peri and postmenopause andropause state. Again, here's just a really great slide of the biochemistry in case you want to nerd out about it later. But basically it shows where that where that calcium D-glucarate comes in to help, again, sort of push out the inflammatory estrogens.
So many of you may have considered bioidenticals if you were or are going through transitions hormonally, or if you're on the other side of the transition and are finding that you're wanting to have balance shifting in regards to your hormones. And this is something that we have found to be very useful within our practices, and something that we feel can be not only helpful and really life-changing for a lot of people, but also can be preventative, can be used as preventative medicine. So often when we're thinking about these hormones, we're kind of putting them into these categories of our estrogens and our progesterones, our testosterone and our DHEA, and we really need all four of those categories to be balanced, to feel good, and to really truly have a healthy life. So when we're thinking about our estrogens, we know that there's a lot of concerns with excess estrogens. Certain forms of estrogens can be very toxic to the body. And we know that we want to have non-synthetics of these in particular. We're very careful in our practice about the forms that we give, not only that they need to be bioidentical for us to write that prescription and to feel good going to sleep at night, just knowing that our patients aren't at higher risk for cancer and things like that. But also we want to make sure that you're getting these, if you choose to take these bioidenticals, that you're getting them in a way that's the least toxic for the body, that the body can biotransfer biotransfer them out if they're for some reason in excess. So we generally are using topicals for our estrogens rather than oral therapies for that, for example, and that bypasses the liver, which is so important for conjugation of these hormones. And when we're thinking about giving the estrogens, typically we're wanting to pair them with progesterone. And that's not necessarily standard of care if you look at the medical world, but it's something that we find to be an important piece for our practice in regards to making sure that there's a balance between that ratio of the progesterone and the estrogen, because we know progesterones can be so protective for tissues in regards to cancer risk, as well as so important for things like dementia reduction as we age. So typically when we're choosing our progesterones, we're thinking more along the lines of a micronized oral. We try to give as little as possible for our hormones. So less is more, and we really are looking for a balance. So we really don't want to, once again, just put all of our energy into one of these different categories. We want to make sure that all of them are really well balanced, and we're not under or over performing in any of these specific categories. A lot of times we will start with something like a topical phytoprogesterone, which is considered bioidentical as well, or provide a prescription compounded. And it's worthwhile saying that not all pharmaceutical progesterone is the same. So even though it might be called a micronized progesterone that you can get from the pharmacy, it may not be the actual same as a compounded, which is actually a different chemical structure, even though they have the same name. So that can be kind of confusing to patients. So we're always trying to choose the one that's going to be the least concerning for the body in regards to cancer risk, but also that will be the most effective as far as rebalancing the system. In regards to testosterone, there's several different ways to provide this in a bioidentical form. Often it's given either in a topical form or an injectable form, and there can be different reasons that we want to use one versus the other with that. It's very nice to have the ability to compound this as well, and to give it to our menopausal women, and not just be thinking about this as a hormone for men. It's really, everyone needs this hormone. So really an important one to take into consideration. In regards to our DHEA, this one is actually really easy for us to get in a bioidentical form that's oral, that's sold as a supplement, as a physician grade supplement. So it ends up being pretty darn cost effective and can really make a difference in regards to the androgens in the body. So we can also get it compounded, and we do that for some of our patients too. Sometimes we're using it as a topical, sometimes we're using it as an oral. So what we've found is the ability to use those bioidenticals really allows us to choose the milligram that we want for our patients, choose what day or days of the week they're taking these hormones, and really to be able to dial in those hormone ratios. And that's been a really incredibly powerful tool for our practice, and has been really wonderful for watching patients who may have been dealing with significant bone loss, for example, and then watching them over several years not only regain some of the energy that they may have lost, or some of the cognitive components that had changed for them either postmenopausally or once they were in andropause, but then to see them return with their DEXA scans, which is the bone scan, the bone density scans, and say, I'm doing it, these hormones are actually making a difference and reducing my risk of having hip breaking or something like that as people age. So it can be a pretty powerful thing. The other piece here that we kind of touched on was this tissue change that can happen vaginally. And one of the big reasons why I am often talking to my patients about utilizing bioidenticals topically, especially for vaginal tissue, is that we know that estradiol, E2, which is our most potent form of estrogen in the body, that hormone is as well as E3. So E2 and E3 are the biggest players here, but that hormone is required for setting the pH of our vaginal tissues. And when we have our pH in balance, we can host our lactobacillus, our good flora. And without hosting our good flora, what we see a lot of times in our postmenopausal population and as we age is that we get recurrent urinary tract infections. And one of the best ways to prevent these is to create the biome that we need, that microbiome, by providing the correct pH. And without the hormones in place there, we can't host our good flora that protects us from those UTIs. So if you're someone, or if you know someone who deals with recurrent UTIs and may have some vaginal atrophy or may have some hormonal changes that's happened to the vaginal area, it can be a very easy, fairly inexpensive way to stop those. And doing that, from my perspective, in a very holistic way of thinking through the physiology of how do we support our good flora and reduce that risk. So for some of our patients, they may have had history of cancers that were estrogen dependent or estrogen dominant cancers. And in that case, it's not considered to be safe. A lot of times we'll talk to their oncologist and confer that it's not safe for them to be on even the bioidenticals that are considered a little safer, like the E3, which is considered more of a protective form of estrogen. But sometimes it's not worth taking the risk for these patients because of those cellular receptors being turned on by estrogen for the cancer cells. So if that's the case, we have other options, such as DHEA, and that's considered a much safer option that still provides the plumpness that we need to those tissues, those vaginal tissues, and can help with the hosting of our good flora down there.
All right, so a couple good slides here on osteoporosis. So one thing that can accelerate after menopause is bone loss. Estrogen, one of its main roles is to help us build bone throughout our reproductive years. So osteoporosis and osteopenia can be silent diseases. So it's really important to get screening for these that involves something we call a DEXA. And let's see, so there are a number of treatment options for this. Bisphosphonates are one that's used in the pharmaceutical realm that we like to reserve for more severe osteoporosis because of its significant adverse effects. And really the best treatment for osteoporosis is prevention, starting at an early age, making sure that you have adequate levels of calcium and vitamin D3 so that you can have the nutrients available to lay bone down when your body gets the signal to. So let's see. Yeah, so part of that piece is weight-bearing movement, which signals our body to create stronger bone. Before medical school, I used to think of bones as just these things that we carry around in our bodies like inanimate objects, but they're actually quite dynamic organs that respond to stress and respond to load, weight-bearing load. So one of the more important areas to focus on when it comes to osteoporosis is the skeleton and the pelvis. So using your posture to stack your vertebrae and provide that mechanical action, and even putting on a backpack and going for a hike with the backpack really tightly adhered to your torso gives you that ability to then signal to your body to build more bone. Also, yoga, Pilates, walking, also great options for that. All right, so now Rosalie will talk about calcium and magnesium.
Yeah, a couple of supplements that are excellent for osteoporosis, osteopenia. And I know we'll sort of breeze through these next couple of slides because we're running out of time here. But hopefully you've got an extra 5 minutes to spend with us. CalMag is a big one. We want to sort of get calcium into the body, is absorbed into the bones, and it doesn't do very well on its own. So we pair it typically with magnesium, which they work synergistically with each other. Magnesium citrate and malate are the best absorbed forms. And I like to sort of have folks take in the evening, powdered before bed, because the magnesium also sort of helps you sleep. And in terms of kidney health, it's worth checking in on because calcium magnesium citrate taken with food can sort of help in terms of regulating any kidney stones. Here's one of our favorite CalMag combos. It's a liquid form. And then here's a sort of magnesium product as well. The glycinate here pictured on the right is more specific, not just to bones, but also to brain. And it helps muscle system, the muscle function, as well as cardiovascular system. Magnesium taken too much is going to cause loose stools. It's sort of an osmotic laxative. So just keep that in mind.
This is another product that we use a fair amount with patients. It's one that has some cool studies that have been done looking at bone scans pre-taking this CalMag supplement. This also, and then seeing those bone density studies increase for women who were in the study. As far as this one goes, it also adds that K2 in, and K2 is a really important one for bone building as well. And then also vitamin D. And so we really want to support with the minerals while we're going through these hormonal transitions to really support any bone loss that's happened. Vitamin K being such an important one also for bone. It's found typically in things like blackstrap molasses and some in our leafy greens, but the K2, which is the one that's best for our bones, isn't really found in much of the food that we're eating. It's supposed to be produced by our gut flora, kind of cool. But we want to think about, like, do we have healthy guts and how is that going to impact our bone health? So I wanted to make sure that we had time for the really cool info on Chinese medicine as well as Ayurvedic medicine. So I'll let Dr. Mary and Dr. Rosalie do these slides.
Great. Okay. So real quick introduction to traditional Chinese medicine. It is a philosophy of healing that's based on the acupuncture meridians, as well as a system that you can see over to the right here of 5 elements. Each of those 5 elements is associated with a major organ, and the acupuncture meridians connect those every part of the body to a particular major organ. Next slide, please. So in traditional Chinese medicine, the main pattern that we see for menopausal symptoms and syndrome is what we call kidney insufficiency. So the kidneys are associated with the water element, and they are what are responsible for long-term reproduction and growth and then aging. So as the kidney essence declines, we lose some of the yin, the moistening, nourishing aspect of the body, and that can predispose us to more dryness and heat, so leading to those things like vaginal dryness and hot flashes. So the main treatment strategy that we use is to nourish yin and clear heat. Acupuncture is one of my go-tos for this. It's been shown to reduce hot flashes by 40%, which for vasomotor symptoms is actually pretty significant. And it's been shown to have a lasting effect. So around 6 months, there is a sustained reduction in vasomotor symptoms for that period of time. So I also really love Chinese herbal medicine for menopausal symptoms. And in studies that it's been shown to be particularly helpful for the insomnia and depression that can come with menopause. Liu Wei Di Huang Wan is one of our main formulas that we use. And one of the beauties of this herbal tradition is there's so many different herbs we can include, and we can tailor it to the individual in front of us. So if someone's having really significant hot flashes and night sweats, I'm going to use more heat clearing herbs. And if someone's having more of that kind of restlessness and irritability and fatigue, I'm going to use more yin nourishing herbs. All right.
Thanks, Dr. Mary, for that traditional Chinese medicine perspective. In terms of Ayurvedic medicine, another sort of traditional Eastern healing modality, but from India. And Ayurveda is the science of life in Sanskrit. In terms of hormone imbalances, the root cause is something known as low ojas, and ojas is our vital force. So similar to sort of the yin deficiency Dr. Mary was talking about, in Ayurvedic medicine, same sort of idea, that vital force is gently diminishing, and with it essentially are the symptoms of low hormones. Generally, we want to treat by decreasing our air and space elements and increasing our juicy earth water elements. So some of the herbs I really love to use, again, they're in this adaptogenic family, the one that helps with stress modulation. Ashwagandha, you might have heard of. It's Sanskrit for the smell of a horse, okay? So it's robust, it's vitalizing, it's especially helpful for libido, and it's sort of the male adaptogen that I use in Ayurvedic medicine. Shatavari, on the flip side, is sort of our female adaptogen. It stands for 100 husbands in Sanskrit. So it tells you a sense for how this herb works as well. Diet and lifestyle can also really help in balancing the hormones. In terms of a diet, we want one that is a rasayana, which just means nourishing. Again, sort of things that are juicy, earthy, watery, that are building that vital force, those ojas. And again, lifestyle, think about easily digestible, warm, soupy, well-spiced meals, a daily oil massage to sort of, again, lubricate all the tissues, including our entire skin, and yoga, meditation to prevent our cortisol, our stress hormone, from getting out of control. I think you're muted, Dr. Molly.
Thank you. I had kids running upstairs and I was like, gotta make it quiet. Thank you all for joining us today. And I just want to make sure we answer some of the questions here and also invite you guys to our next Doc Talk, which is going to be specifically on bone health. We kind of did a little intro to that today and gave you guys a little bit of a teaser, but everybody needs healthy bones. So please join us and spread the word. Let's take a second and just look at some of these questions. It looks like we had some questions come in when we were talking about the cholesterol-rich foods, specifically asking, would flax oil be more important than the flax meal? And for me, I love providing the flax meal for people because it provides such a rich fiber source. And we're already trying to get 30 to 35 grams of fiber a day. And that can be a challenge in our diets for a lot of people. So it's a great I consider it like a non-grain source of fiber that's a good option. So I usually am asking people to fresh grind the seeds and use the whole meal rather than doing like a pressing of the oil or something like that. the oil goes rancid pretty quickly as well. So we like that whole fresh seed ground up when we're thinking about it as a phytoestrogen in particular. And the next question was, if butter is good, what about cheese? So we didn't list cheese on there, not that it isn't a rich source of cholesterol, because it certainly is, and it's a fine option for many people, but typically it's not something that I'm recommending a lot of in my practice to my patients who are either in menopause or postmenopausal or in andropause, because to me, it's a pretty cold, energetically cold and a little bit more heavy, and and pretty salty. And a lot of people are dealing with more issues with hypertension, and sometimes with weight management. So it may be a good option for some of our patients, but it's something that I'm not usually like saying, go out and have a whole bunch of cheese to increase your cholesterol. But small amounts of butter should be fine. And then small amounts of cheese if you are dairy tolerant, but just not as a large amount. Anything extra that you guys want to add, Dr. Rosalie or Dr. Mary, to that?
Just a sort of reminder that, yeah, cholesterol is good for a lot of reasons, but it's also not so good for many other reasons. So it's something that, in terms of figuring out what the right amount and dietarily what makes sense to you, it's just worth getting some blood work and discussing with your physician.
Well, thanks again for joining us, and we will hopefully see you guys next month, and we look forward to it. I hope you all enjoy the beginning of your summer here.